welcome to Veterinary Referral Center of Central Oregon's Facebook Live discussion. I've got Denali in the back who's going to be fielding questions, and our guest, Taylor Stockdale. I'm Jen Bentley, the dermatologist here at Veterinary Referral Center, and I'll let Dr. Stockdale introduce herself.
I'm Taylor Stockdale. I'm one of the ER doctors here at the Veterinary Referral Center. Been here for several months now, enjoying Bend, and ER doctor for a long time.
Yeah, from Seattle. So glad to have you here. Why did you end up picking emergency medicine as a field to go into?
I actually enjoy the pace and the criticalness of it. So probably most. I actually enjoy things coming at me fast and kind of the unknown and working up the problems.
Yeah, you kind of thrive on.
Yeah.
Awesome. Well, we're happy to have you here today for a great discussion on hydration, which it's like 90 plus degrees outside right now, so it's a very timely topic. But before we get started, as always, if you know anybody else who wants to join the conversation, please send them the link. But we'll get started with everything and dive right in. So how do you keep your pets cool during these months in Central Oregon?
Yes, it is hot here. Our dogs and cats especially are feeling it. So the biggest thing we can do is try and avoid dehydration by keeping lots of cool, clean, fresh water around at all times and making sure that our pets have full access to it. Most animals will regulate the amount that they need to drink, and if they're thirsty and it's available, they'll drink as much as they need to stay hydrated. Sometimes you can run into issues if your pet is on particular medications where they need even more water, and those are the ones like steroids or diuretics. We really need to make sure that those guys have lots of clean, fresh water. I usually recommend about one large water bowl per dog that you have. So if you've got 3 dogs, then you should have 3 water bowls at different places throughout the house to make sure that they've got lots of access at all times.
Yeah, so similar to us, we regulate ourselves with our thirst level. They should be able to do that too, as long as they have that access to water. Are there any breeds or anything like that that you would say, hey, these guys are more at risk too, besides the ones on these medications that can be dehydrating?
Yeah, absolutely. So any dog that's got kind of the squish face, so our bulldogs, pugs, and terriers, all of those guys have a lot of extra tissue in their face that can make it difficult for them to release heat from their body by panting. So they really need to make sure that we keep them nice and cool, have lots of access to water. And that being said, those dogs especially, but really all of our dogs, if you want to do something active with them, the morning's the best time here. When it's nice and cool out, they can run without overheating. Even by maybe 11 a.m., it gets just too hot here for them that they're really exposed to heat exhaustion.
Yeah, absolutely. So if you're just joining the discussion, we are talking about all things hydration, so feel free to chime in if you have any questions for our emergency doctor, Dr. Stockdale here. We'll be happy to answer those. And basically, we're talking about hydration as it relates to summer months. That's when we think about animals getting dehydrated, but of course, there are also lots of other reasons that patients here get dehydrated. And I don't know if you want to chime in on those conditions.
Yeah, I think anytime that an animal is not feeling well enough to eat, they oftentimes aren't feeling well enough to drink either. So lots of metabolic diseases can cause nausea, or they say they ate something that upset their stomach and they have any sort of diarrhea or vomiting episodes. That can really exacerbate their potential to become dehydrated. And some things you can do if you're worried about dehydration at home in your pet, I would say if they are lethargic or just not having normal energy, that's something that you would want to be concerned about. If you notice that they're not eating or drinking, that would lead to dehydration. But you can also check, if you're comfortable, the color and hydration status of their gums. If they feel really dry to you and what's normal for your pet, then that could be a sign of early dehydration as well and something to get checked out.
Yeah, absolutely. And it is that, of course, if you're afraid your pet is going to bite you, it's not probably something to do, but it's pretty easy to lift that lip up and see, hey, are the gums pink there, and check that. So that's an easy kind of test that we always do all the time. Are there any other tests you rely on in the hospital for dehydration that they can't necessarily do at home?
Yeah, here we have the benefit of doing a blood draw, and we can really easily check the red cell count and the protein count to see if an animal's disproportionately dehydrated there.
Excellent. Denali, do we have a question?
Yes, Shelby would like to know, what's the deal with cooling vests for dogs? Are they a good idea?
Yeah. So that's a good question. Some cooling vests can be helpful. The tricky part is you really want to use them as a prevention almost. So if you feel like you're at the point where you have to use the cooling vest as a really necessary means to keep your dogs cool, it's probably just too hot to be doing the activity. But they can help to a certain extent if you're worried that they're at home and too hot there. I don't know if you have more experience with them, Jen, as well.
I don't. I've never even tried one, but I would agree it's not something that you would put on in case, but more as a preventative thing, and the amount of that preventative factor is probably low. I think it's, the basics, keeping water around and doing those types of things, keeping out of the heat of the day. Any other questions?
We also have a question from Ernie, and he is asking, can they have too much water? My dog sometimes vomits after a bunch of water.
So, yes, they can drink too much water too quickly, and that's usually the case when they guzzle a whole bowl of water and then regurgitate or vomit it right back up. Overall, though, if you are offering small amounts more frequently, so maybe a little bit and then 5 minutes later a little bit more, as long as you're offering it frequently and your dog is continuing to drink it, they should self-regulate, and their kidneys are usually functional. They'll just urinate more if they're drinking more than they need to, but small volumes more frequently can help if your dog vomits after drinking a huge volume.
Yeah, that's good advice.
My dog was the same.
Yeah. I think a lot of people have been there, definitely. And I think we should talk a little bit too about, not necessarily, it relates to heat, but not necessarily dehydration, but heat stroke. Do you want to talk a lot about that? Because we definitely see that coming through the emergency room, unfortunately.
Unfortunately, yeah, heat stroke can be a huge issue. So there's two extremes. There's heat exhaustion, where animals are overheated, their temperature gets too high, and they can have a lot of issues with the blood volume and blood pressure from that. And then we get to the point where we can actually see damage to the blood vessels from the amount of heat that they get and the temperature inside their body, and we start to see neurologic changes in them, and that's where we get heat stroke. And that can be a life-threatening emergency that needs really aggressive acute treatment. So if your dog is ever to the point where they're so hot that they're becoming really lethargic or mentally inappropriate or dull, that's a really scary thing that we need to be seen right away.
What do you think are the top reasons for heat stroke here? I know myself, I've seen some where, unfortunately the owners left the dog in the car, which is an unfortunate thing. What do you feel like is the most common reason for it?
I've definitely seen them in the car, and usually it's like an afterthought, or I've had ones where the kids load the dog in the car and the parent is not aware, so always horrible accidents. Some of the breed-related changes that we talked about earlier, so the squish-faced guys, they can get heat stroke really easily just because they can't release their heat as well as other dogs. And then a lot of the times, unfortunately, it's doing activities out in the heat that they would be able to do at a normal temperature, but on especially hot days when they're not acclimated to it. I've seen some too in the early spring actually, where it's not too hot. It's not 90 degrees out. It's like maybe 70, but the dogs are used to winter time, and so those days can also cause a lot of heat exhaustion just doing too much.
Yeah. And what are the basics for the treatment of heat stroke? Like, what is going to happen when they bring their dog here for that?
So heat stroke is a lot happening very quickly.
Yeah.
The mainstay is going to be blood pressure support and fluid support. We want to get their temperature back down to an appropriate level, but then we have to deal with the side effects from the blood vessel shock. And so a lot of times we need transfusions with plasma and clotting factors to re-support the animal and get their blood pressure back to normal while their body's trying to catch up.
Yeah. No, it's a good reminder of a pretty serious condition here, but we have had lots of successes with treating that.
Yeah, I have personally lots of success with it. It's something that I'm always encouraging people to treat if it's doable, because it's an unfortunate accident usually when it happens, and a lot of times we can get them through it if we can be aggressive.
Yes. Well, thank you guys so much for joining us on Facebook Live. If you have any other questions, feel free to comment on the Facebook page. And also, if you like this discussion, give it a thumbs up. If you have any comments, please leave those comments. And of course, if you have any other wants for other discussions in the future, let us know. We have experts from emergency all the way up to surgery, so we're happy to bring those guests on. And thank you, Dr. Taylor Stockdale, for coming on with us.
Thank you.